Hello, good day everyone. I am Camille Dumpa from BSN1A. Today, I will demonstrating a charting. So first, it's define what is charting. So charting is a process of preparing a complete record of a patient's care. An accurate, detailed charting shows the extent and quality of the care the nurses have provided. So, the outcome of that care and quality of the treatment and education that the patient still needs. So, charting is a day-to-day, event-by-event documentation of a patient's care and conditions by a registered nurse. So, it is also a vital tool for communication among healthcare team members. Commonly, decisions, actions, and revisions related to the patient's care are based on charting from various team members. So, a well-prepared medical record shows the high degree of collaboration among healthcare team members. So, the nurse's notes is a medical note made by a nurse that can provide an accurate reflection of nursing assessment, changes in patient's conditions, care provided, and relevant information to support the clinical team to deliver excellent care. So, the role of charting, accurate nursing documentation is important for many reasons. First is it's a mode of communication among healthcare professionals. And then the second is it's check and healthcare evaluation. The third is it can be used as legal evidence. Fourth, it used to aid research and education. The fifth is it helps facilities to obtain accreditation and licensure. The sixth is it used to justify reimbursement requests. The seventh is it's used to develop improvement in the quality of care. The eighth is it indicates compliance with the State Nurse Practice Act. And lastly, it establishes professionals' accountability. Types of documentation system. The first one is narrative charting and the second one is SOPI note. So the first one is narrative charting. Allows a basic to a very detailed description of the assessment, care provided and plan, and the patient's response to treatment and teaching. And then the second one is SOPI note. The term SOPI is actually an abbreviation of the parts of the note. These are subjective, objective, assessment, plan, and interventions. The first one is subjective. It refers to things the patients can tell you and often includes pain level and feelings or concerns. It can also refer to things a patient's family members to tell you. So the second one is objective. Refers to hard data you collect regarding the patient. This can include vital signs, laboratory results, observable signs and symptoms, and your physical assessment findings. The third one is assessment. Refers to your overall interpretation of the subject and assessment. Is the patient improved since admission? Are there new issues that you are observing that need to be addressed? All of these things belong in the assessment. The fourth one is plan. Refers to the patient's plan of care. How is the medical team addressing the patient's health problems? Are there upcoming tests or blood draws? Is the patient on medication to treat a problem that you are monitoring a response to? These are examples that fall under plan. And the last one is interventions. Refer to the things we are doing for the patient. Examples of intervention can include treatment and medications, as well as education provided to the patient on your shift. So the purpose of this charting is that provides a means of communication among healthcare providers and a legal record of a patient, used for education and research, and for the nursing audit, the evaluation of the quality of nursing care, and then to reflect the standards of within an institutions. So the materials or equipment that we are going to use are paper and pen, jot down notebook, and lastly, nurse's notes 4.
For the assessment, assess the patient. For the planning, prepare the materials or equipment. For implementation, document exactly what you observe, hear, inspect, do or teach. Document how your patient responds to care, treatment, medication, and his progress toward the desired outcome. Include notification to the physicians for changes that have occurred. Document the physician's response, new orders that are followed, and the patient's response. Organize your notes by using head-to-toe approach or by referring to the care plan and documenting the patient's progress in relation to the plan and any unresolved problems. Organize your narrative note. Be specific and document chronologically, recording the exact time,